With the real infection, you're going to be more likely to have a benefit that's going to be more robust, that's going to be more likely to help you with that, right? And so that's why you have to know what the trade-offs are. So the vaccines, they work. They work on the variants. And if they're 90% effective on a population basis, you want to get to at least 50% of your population to start protecting people. And the studies have shown that those with natural immunity do have equal, if not higher, protection than those who have never been infected in a natural infection at 6 months. There's little change, and you have more diverse antibodies. Add in a vaccine, and you are heavily protected against almost all disease, right? So full vaccination provides additional protection, which is why I told everybody who said, well, Mark, I got the thing. I still want you to get the primary series, right? I'm a big vaccine person. Everybody knows I'm a big vaccine person. I always want people, when everybody's coming in for the checkups, I'm always saying, did you have this? Did you have this? I'm always on it, right? So no question, that's what I want, the primary series. No question, if you have the natural infection, I do want you to have had the primary series also. Most people have, okay? We see that the Chinese stuff is less effective. By the way, full disclosure, I was wrong on one thing previously, where I said that originally I was holding off my young ladies from getting a vaccination. Then I said, look, for those that are ready to step in the pool, I probably do the J&J because it was based on old technology and it was only one shot. And it turns out that probably the mRNAs for young women are a little bit safer. So that's a little change there, right? If you wait longer between shots, that may help. So I've already told you that. So this is the primary series. If you haven't had your primary shots and you say, well, they say, well, do it now and do it again. You know what? If you do one now and you wait 4 weeks or 5 weeks, you're probably even a little bit better off, right? It is normal for antibodies to wait. I've told you that. And if they didn't, our bodies would be filled with antibodies. We wouldn't even have ability to function with blood cells, right? Which is why the T cells become so important. We know that the cold storage has been modified, so it's easy to get this around. And if you've had the infection, say, okay, I had the infection, I didn't take the vaccine, do you still want me to take it? The answer I have is yes, right? And how long do you have to wait? A period of time, right? And it still shows data that'll be helpful for you. If you do go through and have an infection, haven't had the primary series, I want you to take it, right? The positives, with kids, there's less infection severity, there's less transmission, and you're more likely to ensure education continuity, okay? But remember, less kids were studied, right? And again, as I showed you in that 5 to 11-year-old group, right? I have my issues, right? Do I think that they should get it? Yeah. Do I think it's critical? No. Do I think they should get it based on a population basis, protect an elderly person? Yes. Do I think that on their own individual basis, that it makes a big difference for them to protect them? Probably not, probably limited. Again, you're talking small numbers either way, right? So you're more likely to have a negative infection from the vaccination, just the way it is, right? You get these myocarditis, and you have to remember kids get this very lightly, right? Either way, the risks are low. So again, that's an open issue that everybody has to sort through, okay? So in kids, things have changed. 50 years ago, what's the meaning of these marks? Now, what's the meaning of these marks? You can see how these things change over time. Lots of things change for kids, and that's just the way it is. Okay. I want you to keep in mind some things about when you start hearing about deaths, okay? This is very important. First of all, overall, the data seems to suggest that over 99% of all the deaths are in unvaccinated or not fully vaccinated. So you have to keep that in mind. When you start hearing the reports, oh, the cases are up, the counts are up, the United States tested 1 million people are positive. Okay, there's a lot of issues here that you have to keep in mind, right? One is what's called the Peltzman effect, which is people will change their behavior after a shot. So sometimes people get a shot, say, oh, good, I'm good, and now I'm going to go party it up and have a good time and stuff. So some of those people are going to get sick. That's just the way it is, whereas previously they didn't. So that's going to make your numbers look like there's a rise, okay? And vaccines can help both in the household and with friends, right? Now, Israel. So Israel did the mRNA Pfizer. A couple issues they had. First of all, they did show in the primary series these risks of the myocarditis, the inflamed heart, the Guillain-Barré, and there were breakthrough infections in healthcare workers. Okay, no question about it, right? Couple issues. Israel did their vaccination very efficiently and early. They spaced them closer together than average, about 3 weeks. So that makes a difference on how much breakthrough you're going to see and how much you're going to expect from that immunization series, right? They also, what they defined as a severe level was a little bit looser than we might define it, but nonetheless, it's true. And then one other thing, this is a little technical, but I just, full disclosure, I just want to give it to you, and then you can forget I told you this, because a lot of doctors don't even know this stuff. But when you say, I got a PCR test, the PCR test is not a black and white yes and no. The PCR test is based on threshold cycle counts. That's what that CT is. And the only reason I'm telling you this is to understand that you can have a PCR test that's positive, but it's weakly positive. And if it's weakly positive, you start having greater risk that it's a false positive. So when they start having these kinds of tests that said PCR positive, you have to know that I'm always looking at that interpretation to know what does it mean for that individual and certainly for that society. And that was one of the issues also in the Israel data, right? Now, third dose in Israel, okay? The third dose looks at the groups, look at the people, and no surprise, you get higher antibody levels. There's no question about that. There's no question the antibody levels go up, right? That's not my issue. My issue is that if you give a booster and the third and the antibodies, what does it mean? Is it really going to protect that individual? Is it worth the risk of the vaccine? Well, if somebody's 80, which is the median age for severe troubles, okay, that's a different story. If somebody's very obese, if somebody has an active cancer that they're under treatment, different story. I get it. But if we're talking about some in their teens, 20s, 30s, 40s, right? All of a sudden, I showed you the data that this is not the group that has a lot of trouble with these infections, and this is the group that has trouble with the vaccine response, right? So in the Israel booster study, they'll say, oh, there's a 10-fold reduction. You say, wow, that's big, right? You started in their studies from 5 million people, and when you start looking at the groups, you're down to 3 to 20,000 people. What does that mean? That means that the confidence intervals are high, which means statistically that when you have so few numbers based on a large data set, that the chance that these numbers could be wrong or misleading get higher. And next, Israel's a limited population ethnically. They didn't study all the health behaviors. They only follow these people for 54 days. And I'm going to show you why that becomes important, right? And when they say, well, they're 10-fold better, of course they're 10-fold better, but it goes from 90% effective to 99% effective. Well, if you're already 90% effective, you've already wiped out virtually anything of the severe stuff anyways, right? Further, in their study said COPD, which is lung disease, diabetes, heart disease, didn't make any difference. Well, wait. I showed you the data before that said that those things are associated with trouble. So why in Israel were these things not associated? So you can see why the data is not as clean as it may seem. Further, they were studying Delta. I'm not questioning. Delta was a more severe variant, but they weren't studying Omicron. Further, Delta. Do you remember everybody talking Delta? Where did it get started in India, right? But it went away. And India has 1 billion people. They never got anywhere close to immunizing all their population. So how's that possible? It's possible because this is the natural history of these infections, which is why if you only follow people for 54 days, you could be getting false numbers, right? Next, let's take a look at this. You look at this and say, okay, Mark, I've seen this before. You give the shot, people do better. You don't give the shot, they do worse, right? That's what you look at. But look at this. Look at their data. So it's very critical. Look at the age groups. These are the people that account for all that benefit. The 60s, 70s, and 80s. You take out this group, and the booster doesn't seem to make any difference, which is why I'm more equivocal on these